Good afternoon, and thank you for being here today. As usual, I'm joined by Dr. Joe Canner of the Department of Health. He will be speaking to you in just a little bit. I'm going to give an update on COVID and the latest public health emergency proclamation. He will then go through some of the gating criteria and other information, answer your questions, and then I'll come back and give you some additional updates on Hurricane Ida and our continued efforts at recovery there. There is some good news on the COVID front, and that is that we are seeing improvements in our statewide percent positivity, cases, hospitalizations. In fact, yesterday we dipped below 1,000 hospitalizations for the first time since July. All things are relative. I mean, that's much better than the 3,022 we saw at the peak of the fourth surge, but it's 4 times higher than the baseline hospitalization numbers that we had going into the fourth surge. And that's because we had fewer than 300 people in the hospital statewide before the Delta surge actually took root in the state of Louisiana. So the bad news is that there's still a very high level of COVID in the state of Louisiana. In fact, in all 64 parishes. The current weekly transmission rate is 243 cases for every 100,000 people. That's 2.5 times what the CDC would categorize as high. Dr. Canner will go into this more in just for a moment. But I think it just bears repeating that every community in the state of Louisiana continues to have a high amount of COVID, and they're in the elevated risk category as a result of that. So we are moving in the right direction, but as I mentioned before, our baseline numbers are still far too high. We're also recovering from Ida as we continue to navigate through the pandemic, and that caused some disruptions with people moving about, with a lot of people coming in from out of state, people moving in with one another, but also we lost some days of testing, particularly in southeast Louisiana, because of the storm. And I've received the recommendations of the Department of Health, and I'm going to accept those recommendations. And so I just signed an executive order extending the current mitigation measures another 28 days. So that is the statewide indoor mask mandate, including K through 12 schools and college campuses. I think this is incredibly important, and you'll get more information on this in just a moment. But the CDC has put out information that shows that schools without masking requirements are 3.5 times more likely to have a COVID-19 outbreak than schools where children and staff and members are masked. Further, we know there's a lot less disruption to schools because far fewer children actually have to quarantine when there is a positive case identified at schools, when both the individual who tests positive and those in close proximity to them are wearing masks. The number of children infected with COVID-19 has greatly increased in the most recent surge. 7 children, you should know, died in the fourth surge, the Delta surge. And that's nearly as many as the total number of pediatric deaths that had been reported over the previous 15 months of the pandemic. We also know that children, those under 12 at least, cannot yet be vaccinated. And masks obviously help protect them. And in addition to themselves, it protects others. And that is because while it is true that most young children who get COVID-19, and this is not absolutely the case, but it is mostly true that they will not have a serious case of the disease, they are nevertheless contagious. And what we know and what you're going to see in just a moment is disproportionately transmission is being driven by people from 5 to 18 years of age. All of those people happen to be in our K through 12 school systems. Obviously, we continue to look at the fact that the vaccination rate continues to lag behind where we would want it to be. On August the 4th, the day that the mask mandate was put back into place, about 37% of Louisianans were fully vaccinated against COVID-19. As of today, that number is a little higher than 45%. Certainly that's an improvement, and I thank people who've made the decision to be vaccinated, and now we're going to start asking people to make sure that they get their booster shot as well. But quite frankly, it's not enough. And I think Dr. Walensky said it very well the other day. We're not going to boost our way out of the pandemic. We still have, I think the number given us today on the White House call was 70 million Americans who are eligible for the vaccination who've not yet taken it. Obviously, some of those individuals live here in Louisiana, and we're going to continue to do everything we can to get people vaccinated. Today, we are reporting 1,031 new cases of COVID-19. Sadly, we're also reporting 54 additional deaths, and that's a total of 13,850. So we're closing in on 14,000 Louisianans who have died from COVID-19. And I guess the saddest part for me is that for months now, the vast majority of deaths are preventable. And we know that because we know vaccinations are effective at preventing serious cases of disease and death, and that the vast majority of these deaths did not have to happen. We currently have 989 individuals hospitalized with COVID. That's actually up 5 from yesterday. This is the first time in quite a while where we've actually seen a daily increase in the number of individuals hospitalized, although it's a relatively small increase of 5, and one day does not a trend make, but it always bears watching when you see a number that comes in different than what you've been experiencing. 173 individuals are on mechanical ventilators, and that's down from 2 yesterday. To talk more about where we are in our fight against COVID and get more granular in terms of the data, I'm going to ask Dr. Cantor to come up. Please ask any questions of him that you might have while he's up here. And then when he's finished, I will come back up and we will talk a little bit about hurricane recovery.
Good afternoon. Thank you, Governor. Thank you for your leadership. Let's just start by mentioning we got word this morning that a significant amount of funding from federal HHS is going to be coming down to primary care clinics, federally qualified healthcare centers throughout the state of Louisiana that we're very appreciative of. It's going to be a total of $21 million going to a total of 33 different clinics throughout the state. So that's going to be money that's well spent, help bolster primary care, and we're very appreciative of federal HHS for granting that money. As the governor has said, we are encouraged that the trends are going in the right direction. It's clear now that we spiked with Delta sometime around the middle of August and have been making consistent progress since that time. On the flip side, as an absolute number, as a risk of what's out there currently, COVID is still high in Louisiana. And that's why it's going to be important to continue the same mitigation measures, particularly masking, that we've done throughout this surge, at least until we can get numbers down lower. We are at risk because of Hurricane Ida, and we've talked before that anytime you have displacement of people, disruption like that, sheltering, whether it's formal sheltering, in a shelter, or informal sheltering, where a family might stay with a neighbor or a friend who happens to have power or a generator, that's a risk for transmission. We have not yet, thankfully, seen any evidence in our data that transmission has picked up because of that. But it's not conclusive yet. I think we still need another week or two of data to be confident about that. All that to say, we remain at risk or liability for that. Again, very, very encouraged that our numbers are going in the right direction, but we still, at this point in time, even though we're headed in the right direction, have a lot of COVID in Louisiana, and the risk still remains high. And I'm going to walk through some data points on that. If you can go to the next slide, please. And next slide after that. This is the four-quadrant slide that we've looked at a number of times now. I'm going to walk through very, very briefly on this. On the top left, you'll see COVID-like illness. This is the percent of ER visits across the state that are attributable to people presenting with symptoms that could be COVID, suggestive of COVID. You can see that we've had 4 peaks throughout this pandemic. Our first one in March and April 2020, our second one in the middle of the summer 2020, our third one around Christmas, New Year's, and then our fourth one, the Delta surge, which was clearly the largest, which has peaked around the middle of August and now has come down consistently to 4.2%. 4.2% of our ER visits this past week have been people seeking care for what could be COVID. On the top right, you see incidence. This is the number of new cases that get diagnosed every day. Again, you can see those 3 peaks very well. The very, very large fourth Delta surge peaking in mid-August. We have now been decreasing from that peak for 41 days and counting. That's very encouraging, but you'll note that where we land right now is still considerably higher, well more than double where we were prior to the start of this last surge. On the bottom left, you'll see the combination graph. The purple line on the top is testing volume. How many tests are being conducted in the state? This matters for people who want to know if they're positive or not. It matters as well on a population level, public health level. Do we have enough visibility on the virus? Can we see clearly what the virus is doing? You see that big peak in the middle of August as transmission went up. More people were exposed, more people were sick. There was more reason to get tested, and that's why you see that big peak. We did take a hit in our testing volume around the time of Hurricane Ida. Testing sites shut down, people didn't have power, so testing volume did go down, and now you see it going back up. We still are relatively encouraged that we're doing, relatively speaking, a lot of testing in the state, and that's good. To date, in September, we've already logged over 700,000 tests. That's a good number. Last month in August, which was really the meat of this surge, we had just over 1 million tests, and the month prior in July, we had over 550,000 tests. So we've done a good job recouping the testing volume that we lost because of Hurricane Ida. Because of that, we feel confident in these projections. On the bottom of that graph, you see the orange bars. This is percent positivity, what percent of all tests being conducted are positive. This past week, we made more improvement. We went from 10% of tests being positive down to 6.7% of tests being positive. We get new numbers every Wednesday, so we'll get another number to Wednesday, and we hope to see we'll get another number tomorrow, and we hope to see continued improvement on that. And on the bottom right, you see the graph that we probably pay the most attention to, and this is how many hospitalized COVID patients are there in hospitals throughout the state. You can see our 3 surges. You see the Delta surge was by far the highest. We peaked at 3,022 hospitalized COVID patients throughout the state. That blew the prior surge out of the water. Before that, our high water mark was 2,069. We surpassed that almost by 1,000 hospitalized patients. That peak was right in the middle of August, and we have come down consistently. And as the governor said, we're very happy now. Now is the second day that we've been below 1,000 hospitalized patients. We're at 989 hospitalized COVID patients. That's encouraging that we've made that progress, but it still is a lot. And it's about 4 times what our baseline was prior to this surge, as the governor said. And if you talk to hospitals right now, they're still very busy. And a lot of hospitals are still postponing some elective procedures because they are so busy. We're still bringing in auxiliary healthcare workers from outside the state to help hospitals. So I don't think the situation in hospitals has resolved. It's certainly better now than it was a couple weeks ago. and we hope to see continued progress, but hospitals remain pretty busy. I'll tell you, the death toll from COVID continues to be both remarkable and unfortunate and regrettable. Since Hurricane Ida made landfall, we, from the coroners across the state, know of 30 deaths related to the storm. And in that time period, we've had to report out 1,491 deaths from COVID-19. This continues to be a real cause of morbidity and mortality for the people of the state. There was national data that came out just a couple of days ago that showed we have suffered throughout this pandemic as a country the largest drop in life expectancy since World War II, and it's most acute amongst American men. This continues to be a real threat to our health and well-being. Again, we're very encouraged that we are making good progress coming out of this Delta surge, but we're not out of the woods yet. I'll tell you, we'll spare you the time to go through each of these slides for all 9 of our regions. They're in the packet that's been distributed to the press. I'll just tell you, they all look very, very similar. All 9 of our regions look very, very similar as to what statewide picture looks like. I can't pick out any discernible patterns that apply to one part of the state and not another. What we're displaying here really is reflective of what it looks like if you want to delve in and go region by region. So the good news is that we are going in the right direction. That's clear. If you go to the next slide, the bad news, as we mentioned, is there's just still a ton of COVID in Louisiana. This is actually a map of all 64 parishes and what their community transmission risk is, but you wouldn't know that because it just looks like one big red state. All 64 parishes currently rank in the highest of 4 possible categories for community transmission risk. This is a scale that the CDC puts out. It looks at a combination of incidence and percent positivity, and it computes a risk category, lower, moderate, high, or highest, of essentially how likely is it if you go about your daily business that you're going to be exposed to COVID-19, be exposed to the virus that causes COVID-19. And in all 64 parishes of the state, despite us moving in the right direction, the risk remains as high as the scale goes. So that should be a word of caution to people. Again, will tell you, I'm the first one to be encouraged that we have peaked and are coming down, but we're nowhere close to being out of the woods yet. There still is just a ton of COVID out there in Louisiana, meaning that you and your family still need to be safe. There still is as high as possible risk, according to the CDC, that if you go about your daily business, you might be exposed to the virus that causes COVID-19, meaning you got to continue to keep vigilant. You got to continue to do the mitigation measures that now, 19 months into this pandemic, we know keep us safe. And that's masking, that's distancing, that's preferentially being outside if you have any reasonable choice in the matter. And I'll tell you, looking past the next couple weeks, looking to the future, it really is choosing to get vaccinated if you've not already, because that's what's going to protect us against having another surge like this down the road, which we really don't want to. Go to the next slide, please. I want to talk a little bit about what COVID is doing in each particular age group. And through this last surge, the youngest age group, 0 through 18 years old, has emerged as the largest category of new COVID-19 cases on any given day. Today, 24% of all the new cases were in kids below the age of 18. And over the past couple of weeks, that number has typically ranged between 24 and 28 or 29%. You can see with that orange line that about in the middle of our surge, our Delta surge, 0 to 18-year-olds overtook 18 through 29-year-olds as the number one age group for new cases. If you go to the next slide, I've zoomed in here on the Delta surge so you can see a little bit clearer what's happened over the past 2 months. That gray line, that peaks first is 18 through 29-year-olds, and then about in the middle of the surge, early to mid-August, it gets overtaken by kids below the age of 18. And then if you go to the next slide, I've zoomed in specifically on people below the age of 30 to get a little bit more granular. And what you can see here is that the 26 to 30-year-olds are the number one age group for the first half of the Delta surge, and then about the middle get overtaken by both 5 to 11-year-olds and 12 to 17-year-olds. There is just no question right now that kids contract COVID and kids spread COVID. Absolutely no question at all. There's also no question that we can do a lot to control that. We can do a lot to mitigate that spread. One of the things that has been most encouraging to me is when we look at our school data, our kindergarten through 12th grade data, for the past 2 weeks, each positive case has only been associated with an average of 2 close contacts. So for each positive case, an average of 2 contacts had to quarantine. That's a relatively low number. And that speaks volumes to how well schools are operating here, the extent that schools are going to hold in-person education in a safe way. And masking is a very big part of that. So while community transmission remains high, and it certainly is right now, the data is pretty clear that masking allows for activities like in-person education to happen and to happen safely. Very encouraged by the data that we're seeing on that. Masking is going to be important for schools as long as the risk of community transmission remains elevated. Go to the next slide, please. I do want to switch gears a second and talk about another risk group of individuals, and these are pregnant women and unborn babies. We have unfortunately seen a spike in severe outcomes related to COVID-19 in pregnant women and their unborn children throughout this Delta surge, and it's very depressing, to be frank. There's little that's more sad to see severe health outcomes related to pregnancy. Absolutely devastating. And having known some of these cases a little bit more in detail, I can tell you these are tragic, heartbreaking cases. Since the beginning of this Delta surge, we have had 14 severe COVID-19 cases related to pregnancy. Amongst those 14 cases, they have resulted in 6 maternal deaths, 6 pregnant moms have died in this surge, and 10 fetal deaths. 10 unborn children have died just in this surge alone. And we've seen more of these cases in this Delta surge than we had seen in the 15 months prior of this pandemic totaled to date. I've seen more just in the past 2 months with this surge. There's no question that COVID-19 can and does cause severe outcomes when it affects women who are pregnant and their unborn babies. There's also no doubt that there's a really good way for pregnant moms to protect themselves. And I'll tell you, all 14 of these cases were associated with moms who unfortunately were not vaccinated. The data continues to grow here. The COVID-19 vaccines are safe in pregnancy, and they confer a lot of benefits. They confer benefits to the mom, who has a less chance of severe COVID-19 health outcomes during that pregnancy, and it confers benefits both to the unborn child and to newborns. To the unborn child, it decreases their risk of these type of severe complications, and to the newborn. There is data that shows that when mom is vaccinated, those antibodies are transmitted into that newborn, both through birth and also in breastfeeding thereafter. So these vaccines are safe in pregnancy, and they're highly beneficial in pregnancy. And when you look at numbers like this, 6 maternal deaths, 10 fetal deaths, just in this past surge, it really is heartbreaking. I cannot encourage families enough. If you are pregnant, if you are expecting to become pregnant, the vaccine is so very important to you and to your unborn child. And that recommendation is also made very strongly by the CDC. It's made by the American College of Obstetrics and Gynecology. It's also made by the American Society of Maternal and Fetal Medicine. Taking a step back and looking at vaccines in general, there's been 2.3 million Louisianans who have at least initiated, 2.3 million doses of vaccine have been administered in the state of Louisiana. Just over 50% of the general population of Louisiana has at least initiated the vaccine. If you look at adults, almost 2/3 now of the adults, 64% of adults in Louisiana have at least started their vaccine series. So we continue to make incremental progress here. And it is encouraging to me to know that if you're an adult living in Louisiana right now, odds are that you've at least gotten a shot. That's encouraging. If you are not yet vaccinated, odds are the majority of people around you, if you look at the numbers now, have made a different choice. So I really do encourage people to look at the accumulating data nationally. There's been now over 388 million doses of vaccine administered nationally, and we've never had as robust a safety monitoring apparatus as we have right now. These vaccines are safe, these vaccines are effective, and these vaccines would be what prevents us from having a damaging surge like we're coming out of right now. That case has never been more clear than when you look at what's happened in our nursing homes. If you go to the next slide, and we look at this graph about every week, it's really notable what has happened in this last Delta surge in nursing homes. And I'll let you know, at this point in time, 87% of nursing home residents in the state have initiated or completed the vaccine series, and 59% of nursing home staff have. We did see small increases in cases this past surge amongst nursing home residents. That's the blue line. But you can see that increase on the far right of that graph is far smaller than it was the prior 3 surges because of the protection that the vaccines provide. More importantly, despite that small increase in cases, we did not see a big spike in deaths. And you see that orange line, which is deaths amongst nursing home residents, being relatively flat despite that smaller increase in cases. That's the proof right there. In the most challenging of settings, where the stakes are the highest because nursing home residents are amongst the most vulnerable to severe disease, where it's the most challenging to control spread because it's a close-knit congregate setting where staff are going from room to room and patients are congregating. These vaccines have really been a game changer. Every time we look at this slide, we're struck at how powerful the effect of these vaccines are. And I'll tell you, if it can work in a nursing home setting like that, it can work in the rest of the population if we just get enough of our neighbors vaccinated. Big news at the end of last week is the availability of booster doses. I wanted to spend just a couple of minutes reviewing who is now eligible for booster doses. And I'll start by saying this is different from a 3rd dose of vaccine for people who are immunocompromised. We announced about a month and a half ago that if you suffer from moderate or severe immunosuppression, and this is a small number of people, we're talking about people who are getting chemotherapy for cancer, people who are transplant recipients and take medicines to suppress their immune system, people who are on chronic high-dose steroids. It's a small number of people. Those individuals probably need a 3rd dose in addition to their first 2 to get the same type of immune response that other people get. This is for people who got Pfizer and Moderna, and they're advised to get that 3rd dose up a month or longer after their 2nd dose. That's nothing new. What is new now is if you got Pfizer and you completed that series, meaning you got your 2nd dose at least 6 months ago, there is now a growing body of evidence that suggests you might benefit from a booster dose, and you're likely or potentially now eligible for that booster dose. So again, this is just for people who got Pfizer and just for people who got their 2 doses at least 6 months ago. There are 3 big categories of people who are now eligible for Pfizer booster doses. Number 1, people who are 65 years of age and older. Number 2, people who are 18 and older and have one of a number of underlying medical conditions. And these are the same medical conditions we've been talking about throughout this pandemic that put people at increased risk for bad outcomes. And it can be severe conditions like cancer, and it can be relatively common conditions like high blood pressure and diabetes, both of which are very common, unfortunately, in Louisiana. So if you got Pfizer more than 6 months ago, and you're over 18, and you have an underlying condition, you are now eligible to get a booster dose. Also, if you got Pfizer 6 months ago, you're over 18, and you live or work in a setting that puts you at high risk for exposure to the virus, you are also eligible to get a booster dose. This is a lot of people. This is anyone who lives in a congregate setting, whether it's a nursing home or an assisted living facility or a shelter or a jail or a prison. It's anyone who works in a job that puts them on the front lines, whether they're a healthcare worker, a teacher, whether they work in the service industry, or a number of other jobs. All those individuals, if they're 18 and older, they got Pfizer more than 6 months ago, they're now eligible for a booster dose. I'll tell you, the data here is absolutely strongest in people who are over 60. A lot of that data has come from Israel, and it is very clear. If you're over 60, a booster dose is very, very much in your best interest if you got Pfizer more than 6 months ago. If you're between 18 and 60, you're eligible for the booster. And if you have questions about whether it's the right decision for you, I encourage you to have that conversation with your medical provider. I'll tell you, the risk-benefit calculation might sway a little bit depending on what your personal risk is and how much exposure risk you have on a day-to-day basis. And I want you to have those conversations with your doctor or your nurse practitioner. But the booster doses are eligible. You are eligible for it, and we're not asking people to present a physician's prescription or show proof of a job. We want to make as few barriers here as possible. All we're asking is if you have questions about whether or not it's the right decision for you, talk to your doctor, get those questions answered. And the last thing I'll mention before I take a couple of questions is we continue to offer monoclonal antibodies. There's over 140 sites that you can receive monoclonal antibodies across the state right now. We have added 7 or 8 new sites in the past couple of weeks. We'll be adding a couple more in the coming weeks as well. And monoclonal antibodies, again, are a treatment for people who have COVID-19, are not yet sick enough to be in a hospital. And the point of the treatment is to keep them not sick enough to be in a hospital. They do work much better the quicker that somebody gets them. There are eligibility criteria for them. Point being, if you have been told that you're positive for COVID, your immediate next call should be to your doc or your NP. Ask them if monoclonals are right for you. If you want a list of where they're offered in the state, 211 has that, but there's pretty good geographic spread, and at the moment we continue to have good supply of monoclonals. So if you're told that you're COVID-19 positive, your very next step should be to talk to your medical provider, see if monoclonals are right for you. They're absolutely not a substitute for the vaccine by any means. We want people to get vaccinated. But if you are positive, they can increase your chance of staying out of the hospital, particularly if they're given early or quick. Pause there. I'd be happy to answer any questions if there are any. Yes, sir. Did you have a question? I'm sorry. Yeah.
With all the numbers that point up the problem today, what do you think it would take for us to get past the mitigation measures? I mean, like with the hospitals, if it was cut in half, or the deaths were cut in half, or just any guidepost you could cite to where we need to be?
Yeah, it's tough to put a specific number on that. We look at this we look at it every week, but we look at it with the governor in increased detail every month when these orders come up for renewal. And I think, the best thing to say is that we'll review the data, just as closely as we did this time, next time around, and make the determination. It's just very tough to take off mitigation measures when the risk of community transmission is as high as it possibly can be in all 64 parishes. What the situation is going to look like a month from now, I really don't know. I'm hard-pressed to say there's one specific measure that carries all the weight. It really is a totality, but at the end of the day, you really can't roll back measures while the community transmission risk is so high, and hopefully a month from now, it won't be as high as that. Melinda?
On the booster shot issue, do you know how many people are eligible and what kind of interest levels are we seeing thus far? And if I can just add, in terms of nursing homes, are most of the people at nursing homes not eligible because they got Moderna?
Yeah, that's right. Most nursing home residents got Moderna, so they're not eligible for a booster dose yet. If they have moderate or severe immunosuppression, they would have been eligible for the past month for a third dose. But not yet a 6-month booster. We do expect news from the CDC and the FDA within the month, 3 or 4 weeks, on Moderna and Johnson & Johnson for booster shots. And I'll just talk a second about that. I think I've heard a lot from people who got Moderna and Johnson & Johnson that are a little bit frustrated that there's no booster shot news that's applicable to them. My wife is one of them, so I hear a lot of frustration about that. We think news is coming. So people that got Moderna and J&J, just hold on a little bit longer. There's been about 33,000 of these booster shots or third doses given out so far. In terms of what the universe is of how many people are eligible, it's actually tough to get a good number on that because those last two categories of people that have any one or any other underlying conditions, or people that live and work in a place that puts them at high risk for exposure, it's challenging to parse that down to get an accurate number. So I don't have a number, but our intent here is to make the criteria broad with as little barriers as possible and give people the option, if it's right for them, particularly after a discussion with their doctor, to avail themselves of it if they think it's in their benefit. Yeah.
As far as pediatric deaths, how many are unvaccinated compared to vaccinated?
All of our pediatric deaths are people who are not vaccinated. We unfortunately have had 7 pediatric deaths in this Delta surge, 16 total throughout the pandemic. Yeah. Great. Yep, Melinda?
For you. In terms of the monoclonal antibodies, are we having any difficulty because the Biden administration announced going to be changing the way it was allocating those?
Yeah, not yet. We're holding our breath on that, but not yet. What the federal administration said is after a couple months of really robust supply, they do anticipate some shortages going forward. And I think, to be completely frank with you, they're looking at what's happening with Delta, realizing it's going to the rest of the country now, and trying to ensure that they have supply. We are thankful that when we surged with Delta, we had absolutely no supply limitations at all on monoclonals, and we haven't yet. The Biden team estimated that states are going to see about a 30% reduction of their monoclonal supply. We have not yet had a cut that affected our ability to give it out. So essentially, week on week to date, we've received more supply from the feds than we have administered. I don't know if that's going to hold, particularly because the calculation that the feds are using is they're looking essentially at how much COVID was in your state last week and then calculating an allocation number. And if our numbers continue to go down and other states go up, that might change our calculation. It will change our calculation. So we're hoping that we don't see any cuts that really affect us. We haven't yet to date. Thank you.
Thank you, Joe. I'll tell you, we are blessed to have a tremendous team at the Department of Health and the Office of Public Health who've been working extremely hard, a lot of long hours, and 7 days a week for many, many months now. I do look forward to the day when we can throttle back on the mitigation measures. I can't tell you today when that's going to be. I just know it's not today. I can tell you that it appears to me if we maintain the course that we're on for another 30 days, our number should be at, or at least closely approach, those baseline numbers that we had going into the fourth surge. And I think it's safe to say once we do that, we're going to feel much better about things. We are continuing to respond to Hurricane Ida and to recover from that very strong and devastating storm. I haven't spoken to you all here in Louisiana since I returned from Washington, D.C. last week, so I did want to just give a very brief update. I went up last week, spent I think it was 3 days, where I met with members of Congress from both parties, primarily those in leadership and those on appropriations committees, both House and Senate, Republican and Democrat. And of course, I met with our entire congressional delegation. I also had meetings at the White House with the President's administration to discuss the needs of Louisiana, both as it relates to Hurricane Ida, but also our continued needs to recover from Hurricanes Laura and Delta in southwest Louisiana. Housing is obviously one of the most pressing issues that we've discussed, and it runs the gamut from everything from those first measures around sheltering to temporary housing and permanent housing. The permanent housing, as you know, the first part of that is administered by FEMA. The second part is administered by HUD, primarily through Community Development Block Grant Disaster Recovery funds. And I know that while I was in Congress last week, an instrument was introduced in the House that would afford more funding to HUD in this program. And obviously it was attached, it was in the continuing resolution, the CR, and attached to that were some other things that were unrelated to disaster housing, like keeping the government open, responding to Afghan refugee resettlements and that sort of thing, but also the debt ceiling. That instrument failed to get the votes necessary in the Senate. I do look forward to Congress quickly figuring out how to keep the government open and making sure we don't default and that we maintain our standing in the world when it comes to the full faith and credit of the United States, but also obviously looking forward to them quickly funding our recovery needs as it relates to housing and other things. There was money in that instrument related to transportation, to the Corps of Engineers, to commerce with respect to fishery, emergency and disaster, and a number of things in addition to the CDBG. So I was encouraged by the meetings. We were very well received by everyone. There's not any opposition, as best I could tell, to the disaster relief component of the instrument that failed last night, which is why I'm optimistic that they'll find their way through in the next several days, I hope. This weekend, President Biden did approve my request for an additional 15 days at 100% federal funding for public assistance Category A, which is debris removal, and Category B, which is emergency protective measures. And that was both for Hurricane Ida and Hurricane Laura. So that does have some additional relief for local governments in southwest Louisiana as well as to southeast Louisiana. Additionally, the President increased the overall federal cost share to 90% for FEMA public assistance funding due to Hurricane Ida. This morning, we're down to less than 8,000 power outages, which is great when you consider that we were at 1.1 million at the peak. It's not any better if you're one of those 8,000. We fully acknowledge that. There's some work to do. Those outages, as you either know or could likely guess, are down in Lower Jefferson and the Grand Isle Lafitte area, but also in the further reaches of Lafourche and Terrebonne Parish. We continue to have 1,732 service members in the National Guard activated in support of current operations across Louisiana. Today they are supporting 8 points of distribution and 1 hub in 3 parishes. The CPRA continues to work with the National Guard, the Corps of Engineers, Jefferson Parish, on Grand Isle, with a sandbag mission. Nearly 1,200 super sacks have been placed into the Burrito Levee to fill breaches that were caused by Hurricane Ida. Those efforts should be completed in the next few days, weather dependent. And the Department of Transportation is assisting in hauling and filling those super sacks. And of course, the Department of Corrections worked very hard in order to make sure they were filling the individual sandbags, because these are not just sand, bulk sand put into the super sacks. These were individual smaller sandbags to make those super sacks more durable, because we don't know how long they're going to have to be in place. With respect to debris, as of this morning, 2,291 shoulder miles have been cleared in the affected area. This is about 21.3% of the roadways in that area. Right at 1 million cubic yards of debris have been removed. You can track daily update with respect to debris removal at 511la.org. DOTD also continues to support the Department of Children and Family Services and shelter movements as shelters are consolidated as individuals are returned home. As of this morning, there were still 314 people being sheltered in 7 shelters across the state who evacuated either before or shortly after Hurricane Ida made landfall. DSNAP is in phase 2, currently underway for the following parishes: Ascension, Assumption, Iberville, Jefferson, Livingston, Plaquemines, St. Helena, St. Mary, Tangipahoa, and Lower St. Martin. There's an alphabet schedule, so the day of the week that you can call if you're from one of these parishes will depend on the first letter in your last name. So for more information, please call 888-524-3578. You select language and press 6, or you can go to the website at dcfs.la.gov/DSNAP. In the first week of DSNAP, there were 73,091 DSNAP applicants who were served, and more than $23 million in nutrition assistance benefits made available to them. As of about 12:30 today, they had received more than 7,000 calls. There have been more than 40,000 disaster unemployment assistance claims filed to date after Hurricane Ida. You can apply online by going to www.laworks.net and use the LWC Hire portal. If you don't have access to the internet, we do encourage you to use the internet if you possibly can, but you can file a claim through the Unemployment Insurance Claim Center by calling 1-866-783-5567. To date, FEMA has approved more than 495,752 applications for disaster assistance, and over $638 million has been approved to help Louisiana's residents recover. The total registrations to date are more than 758,000. Right at 8,000 households are checked into the TSA program, Transitional Sheltering Assistance Program. More than 23,000 household members are sheltered in hotels rooms as a result of that. With respect to flood insurance claims, there have been almost 13,000 claims filed in Louisiana. About $67 million has thus far been paid out through the program. And about 4,600 SBA loans have been approved for more than $211 million. The Corps of Engineers and their contractors have installed right at 9,000 blue roofs, and that effort obviously will continue. And I think that's somewhere around a third or so of all of the valid blue roof registrations. Tomorrow, weather dependent, I do hope to travel to Grand Isle to visit with local officials there, but also with the National Guard soldiers and the folks from the Department of Transportation and others who are working so hard in order to repair the breaches caused by Hurricane Ida on that levee. And we don't yet know when our next press availability is going to be, but we'll certainly keep you informed. And I know that that's a pretty long press conference. However, we are going to take a few questions now, if you've got them. Yes, sir.
Governor, good afternoon. Is your office looking at ways to improve communication and the time it takes to transfer money between GOSEP and FEMA to get some of our school districts the funds that they need to recover?
I didn't understand the last part of the question.
Is your office looking to improve communication and the transfer of funds between GOSEP and FEMA to help get some of these school districts the money that they need?
Oh, yeah. So principally, that's been an issue down in Calcasieu Parish. And the answer is yes, and we've been working on that for quite some time through expedited project worksheets, but also as soon as FEMA obligates money, a certain percentage of that gets cut in a check to the school district right away so that they can continue their work. And then they look through all of the information that's being submitted to determine their eligibility. Because the last thing we want to do is have to go back and ask the school district to pay back money that they should not have received. But in terms of speeding that up, absolutely. And it's something that I've talked about with our folks here at GOSEP as recently as today. But we've done that a number of times since late August. We actually had a meeting in Calcasieu Parish with the superintendent who was present, and he was expressing some concerns about cash flow issues as related to the construction effort there as they continue to recover from Hurricane Delta. And part of that is getting FEMA to obligate the funds, and then after that happens, then we have to make those funds available as we verify that the procurements have been done correctly, that all of the costs are, in fact, cost reasonable and in accordance with FEMA rules and so forth. But speeding that up absolutely is very important. And I think there's been really good progress on that of late. And I know there have been good conversations between GOSEP and the superintendent in Calcasieu Parish as well. Yes, ma'am.
Governor, we're, as you know, a month removed from Ida at this point, and it seems like there still isn't a lot of progress on temporary housing, short-term housing for people. What is the status of negotiations with FEMA, and when can people start to expect some movement on that front?
Yeah. Well, I think you're going to start seeing over the next several days the movement of various assets into state and positioning those, especially as it relates to trailers, like travel trailers and so forth. It gets a little bit complicated because travel trailers are available under non-congregant sheltering, which can be directly run by the state, and that's a function of public assistance and subject to the cost share and so forth. And there's a program manager who's been selected, and you're going to see that effort start very soon. But the direct run FEMA temporary housing initiative will look very similar, and it's going to have group sites for trailers, including travel trailers. And then the preferred thing for most homeowners who, at least for whom this is an option, is to have a travel trailer on their premises. So they have to obviously have electricity there, the ability to hook into a sewer system. But that is the preferred option for most of these individuals. Now, we continue to press FEMA every single day for them to make the decisions necessary and pull the triggers in order to move these assets and get this program, started. And I fully expect that we're going to see that soon, not soon enough. It has been frustrating for everyone involved. But I believe we're going to see some movement on that very soon, and I think you're going to see it on the non-congregant sheltering side as well.
What is taking so long? I know it
Yeah.
historically has always taken long, but in this instance.
Well, it does take long, and quite frankly, we were very upset about the length of time before these assets were brought to bear in Southwest Louisiana last year. We're nowhere near the amount of time having elapsed after Hurricane Ida yet, as was the case before these things were actually stood up in Southwest Louisiana last year, which we weren't satisfied with. But we're continuing to push. And, you know, I have meetings and I get explanations, but I'm not going to try to recite for you everything that I was told by FEMA as to what's holding them up. I would think you should address that directly with FEMA in terms of what is causing the delay, what information are they still trying to gather or to refine or so forth to drive their decision making. It is not satisfactory, regardless of what it is, and we're pushing them, and that's one of the reasons that I went to the White House last Thursday to move that program much faster. And, you know, I have to believe that they will, and that in the next days you're going to get a lot more information. But I would ask that the specific information about what's causing the delays be asked of FEMA. Yes.
Talk to members of Congress. Do they tell you the disaster component is going to pass? Don't worry. Or they just listen politely, or they just say you're just caught in a whirlwind that doesn't have anything to do with disasters? Or
Well, yeah, and look, it was actually put in these terms on more than one occasion in those meetings, that there may be some collateral damage related to the debt ceiling suspension portion of the legislation that was introduced. And the damage wouldn't mean that we wouldn't get the disaster assistance that we're looking for, that it may be delayed, but really delayed by just a few days, because there was nobody, Republican, Democrat, House or Senate or administration, who even wanted to contemplate a government shutdown, which would happen on the 1st of October, as you know, if they don't find money to keep the government open into the next fiscal year. And all of that led me to believe that even if the instrument failed yesterday, as it did, that between now and the end of the week, they would find a way to pass an instrument to keep the government open and that would contain this relief. And when we say the relief, I want to be clear about something. There are $5 billion in the instrument for community development block grant disaster recovery funding that would flow through HUD. No less than 1.61 billion of that would be for 2020 storms, and that's throughout the whole country, which provided a floor, not a ceiling, so it could be more than the 1.61 billion. And then that money's got to go to HUD. HUD then determines how much of that will in fact be applied to 2020, and of that amount, how much will come to Louisiana. And they have 30 days from the time that instrument passes to tell us what the allocation is. Not to make the allocation available, but at least tell us what it is. And should it be insufficient for some reason to have the robust recovery program with respect to housing that we think we need, then we will be back because we know Congress will take up another appropriation instrument in December. And we will be back asking for more money both for 2020, and everybody understands that the initial funding with respect to Hurricane Ida and the 2021 storms is a down payment. And that's because the damage numbers just have not been completed. They're not refined. But I expect and will be extremely disappointed if in the next few days we don't have an instrument past Congress that gets that disaster relief funding that I just mentioned at least started in Louisiana. Okay. Oh, I'm sorry.
There was discussion before Ida about some sort of vaccine mandate or testing requirement for state employees, and obviously that got set aside for a little while because of the storm. Where does that stand in terms of setting a plan for what state employees are going to be required to comply with?
Yeah. Well, one thing I can tell you is that we continue to, and I think I made the case today, I think Joe made the case, continue to make the case for people to be vaccinated because it's the right thing to do. It's right for them, it's right for their family, it's right for their community, and certainly right for everybody else in their workspace. And that's true whether you're a state employee or not. Secondly, I would tell you that a number of things were not pursued because of the storm, but also because of some other logistical challenges, because as you will recall, the discussion we had was preliminary in nature, and it indicated that individuals who, for whatever reason, continue to choose not to be vaccinated would have to be tested. Well, standing up the testing program that would be required is very challenging. And one of the things that was discussed this morning on the call with the White House is a shortage of some of the rapid testing that would have to be required. So at this point in time, we're continuing to ask people to be vaccinated because it's the right thing to do. It's the way to get through the pandemic. And I am not actively pursuing a mandate other than adding the COVID-19 vaccine to the schedule of vaccines in law that would put it on equal footing with other vaccines that people have been taking for years, for measles, mumps, and rubella, and other things. Okay, look, thank you all very much. I'm going to talk for just a second about flu shots, and that is because people with the flu tax the very same part of our healthcare delivery system as people with COVID. And we just told you we have right at 1,000 people still in the hospital with COVID as we get into flu season. So just like we're asking people to get their vaccination, please get your flu shot. It is extremely important. And so please do that. They're available as they always are. But if we want to make sure that we preserve our hospital capacity, especially should we have another COVID surge, it would be awful if we had a lot of hospitalized patients for the flu at the same time. So please take every advantage of the flu vaccines that are out there. Let's get vaccinated with respect to the COVID vaccines. Get your third shot if you're immunocompromised. Get your booster if you're a Pfizer vaccine. If you were vaccinated with Pfizer and you're eligible to do so. All of this is important to defeating the pandemic. And thank you all again for continuing to cover this, and we will let you know of our next press conference.